So for this series, we're looking at things.
Good, because I crashed into the chair.
Yeah. Not a distraction at all. So for this series, we're talking about things that are normal or treatable. So, Dr. Rube, what do you think?
Well, one of the most common ones I get, is it normal that I now pee when I cough, laugh, and sneeze and do jumping jacks?
I tell patients this is very common. Over 50% of women after 50 can have some form of urinary incontinence, leaking when they cough or sneeze or exercise, but it's not normal. So there are things that we can do to fix it. We start off with very conservative things like pelvic floor exercises, and then there's also some treatments surgically that we can perform that are minimally invasive, outpatient, and you can get back to activity pretty quickly. So as far as the other question we get all the time, is it normal to wake up several times a night to urinate?
Oh yeah, it's a pet peeve of mine.
Yeah.
It is actually normal to wake up a couple times at night after age 50. It's a hormone shift that we have where we start making more of our pee at night. Now, if you're waking up more than that, or you're actually leaking before you get to the bathroom or leaking in the bed, that is something that is treatable, and we can talk about that. Sometimes it just takes more than just treating the bladder. There may be other medical conditions that are also adding to that.
And it's crazy because a lot of women think it's normal, or they just live with it. And I love the fact they come in and they start talking about it with us. So, my thing is, I want to make sure that they know that these things are treatable.
Absolutely. We get a lot of women in here saying that, is it normal for me to feel like a vaginal bulge or pressure at the opening of the vagina?
Yeah, and I tell them, no, that's not normal. But it's common, but a lot of women don't talk about it. And so it's probably underdiagnosed. Mm-hmm. And so we see women in our practice that come in and they feel a bulge, and I tell them that this is not normal. It can cause a lot of problems. It can cause urinary tract infections. It can cause incomplete emptying, just uncomfortableness in general, sexual dysfunction. And so these are treatable issues. I mean, they can go to pelvic floor therapy, which is really conservative, or we have very minimally invasive surgical procedures now that we can perform in an outpatient setting, which is pretty awesome.
Yeah, we're here as a resource for you to help you figure out what is normal and what's treatable for you, and help you guide down the right path for you.